Why do infected cysts always come back? Why is drainage not enough to remove them? Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine provider. Today's topic is infected sebaceous cysts slash abscesses. So a lot of you know what sebaceous cyst is, so I will just remind you very briefly. Sebaceous cyst is a subcutaneous mass, a small bump, so to speak, that is associated with a hair follicle. And it's filled with sebum, which is a cottage cheese-like substance that I'm sure you've seen. It is the same substance that you see in your pimples, so the same thing. But sometimes this substance organizes and creates this sebaceous cysts. And cysts are actually very beautiful when they're not infected because they present as this circle, as this round structure that is very symmetrical and has a membrane, has a covering. And inside of it, there is this sebaceous content, which is called sebum. So when it's not infected and it's intact, it's a very beautiful structure. So, but today we are talking what happens when they get infected and why drainage is not enough to treat them. So first of all, when we see somebody with a sebaceous cyst, the first question is, why did it get infected? And sometimes, honestly, nobody knows why. But sometimes the reason the cyst gets infected is because whether the person themselves or their spouse or another well-wisher was squeezing it or putting a pressure on it, trying to pop it, or trying to do warm compresses, hot showers, and all of these things that actually irritated that cyst and led to an infection. So sometimes it's a self-inflicted infection, but many times it's hard to know because friction could be one of big reasons for these cysts to become inflamed and then infected. But often, like I said, we don't know because often we have had cysts for a very long time. Let's say you've had cysts for years and nothing has ever happened to them. And then one day it gets infected. A lot of times in the same vein, people ask, what happens with the cyst naturally? Natural course of the cyst is that it may be the same and never get infected for years and years to come. B, it actually could get smaller. I have seen that numerous times in our clinic where a cyst that I was keeping an eye on actually is no longer found because it got smaller, so small that you can't even palpate that. Those cysts are called involuted, or they are said to have collapsed. So that's a wonderful scenario, of course. And the third scenario, so the first one that they get smaller, the second one they don't change. The third scenario, they get infected. So when infection is mild, what happens? How do we define a mild infection? First of all, let's talk about 4 characteristics of an infection. So as I mentioned earlier, cyst is a bump, and usually it's just a skin-colored bump. It could be anywhere. It could be on your back, which is a very common location, could be on your face, could be on your arms. So essentially, most of the trunk and upper extremities, buttocks, those are common areas for cysts. So if you have there are 4 characteristics of the cyst. So they are redness. That's very important. And usually it starts with the mild redness and then it gets worse. The next one is increase in size. That is also not subtle in later, but in the beginning it may be very subtle. The patient may say, well, it feels that it's a little bit larger. And then we compare it with our previous measurement, and indeed it is now much larger. The next one is worms. And what I mean is heat. One time I did say worms, and one of the patients thought that I was talking about worms, the parasites. I think it was my accent. But no, what I mean is heat. I mean worms. So when it feels warm, and again, that may be subtle in the beginning and not so subtle when it's a late infection, then that's a good sign that the cyst is unfortunately infected. And pain. Pain is very interesting because sometimes pain could be the first symptom and sometimes pain could be a late symptom. And I think it's related to people's pain threshold because some people, it takes a lot for them to feel pain. They may say something like, oh, my spouse noticed that it's getting bigger, but it doesn't bother me. And vice versa, sometimes they would say, oh, I just feel a very strange sensation, especially if I lean on it, especially if obviously if the cyst is on the back, and now it hurts me. So I never ignore that because the pain is a very important symptom. In some cases, pain, when it's the first symptom, it tells me that the cyst is getting inflamed, that it's getting infected. So the patient comes in with an early inflamed cyst. So let's say we have this bump that's a little bit red. It increased in size. It's a little warm, and it's a little painful. Let's say just a little of all of these symptoms that we listed. What do we do? Usually, the first thing that we do is evaluate the patient, and if it's a healthy patient with no problems at all, in some cases, the cyst can just, this infection can run its course and gets better. But to be honest, usually by the time they end up in our clinic, that means that it hasn't gotten better. So in most of the cases, I do prescribe antibiotics. So we're talking about infected, mildly infected cyst, but obviously infected cyst. So we do prescribe antibiotic, and usually it's a 7-day course. I try to prescribe antibiotics for as short of a time duration as possible due to all of its effect on our gut microbiome, as we've discussed in other videos on this channel. So, but we do, of course, we do prescribe antibiotics for an obvious infection. So what is the next scenario after that? The next scenario is this. Either this gets better and basically the cyst, the infection is gone. The cyst remains, by the way. The cyst is not gone from antibiotic. It's the infection that is gone. And I usually tell the patient, I say, once infection is gone, if you would like to have it removed electively, that's up to you, but we need to make sure that you have no infection at all. And usually that may take a few weeks. Preferably, it's better to wait a few months after the infection to remove the cyst. And I will get back to that in a few minutes again. However, let's say in a scenario where we prescribed an antibiotic and patient actually is not getting better, or if it's somebody who just came off the street with a very infected cyst. So now we are moving not to a mildly infected cyst, we're moving to a truly infected cyst, which is actually an abscess at this point. Most of the time, there's a very fine line between a moderately to severely infected cyst and between a full-blown abscess. So when somebody comes in like that, then in that case, drainage is the next step. And drainage is not the procedure that I take lightly. Why is that? Because drainage is painful for the patient. It's a very simple and easy procedure. However, it is very uncomfortable. The reason it is uncomfortable for the patient is because first of all, the cyst is already painful, or the abscess is already painful when you touch it. So now when you numb it, unfortunately, the inflammation and infection do not let the numbing medication exert its full effect. So what it means is that it's not getting numbed up as well as we want to. So we put, of course, more and more of numbing medication, but there's a certain limit. So that is why it's a uncomfortable and unpleasant procedure for the patient. But the good thing that it is a very short procedure. So as I numb the area, then usually pus mixed with sebum and these pieces of sac come out. And it's a very satisfying because it's satisfying in a sense that we take care of the problem and we know that the patient will keep getting better and better. So, and usually I pack that opening and I try to make that opening not too big and not too small. It depends on the size of the cyst, but it's important for cosmetic reasons not to make it too large. It's not necessary, but yet not to make it so tiny that pus can't come out. And I usually instruct the patient then it's a good idea to actually use warm compresses. It's a good idea to be in a hot shower because it stimulates more drainage. And the more drainage comes out of that small hole that was surgically created, the better it is. So usually when patients call after the procedure and report, oh, I've had a lot of drainage, we say, well, that's wonderful. That means it's just draining out. All of that goo essentially is coming out. So the next step, which is an important step, as patient gets better, they are interested in the removal of the cyst. And that's where a lot of misunderstanding occurs because a lot of people believe that after the drainage, the cyst could be removed, or at the time of the drainage, the cyst could be removed. But that's simply biologically impossible. even though we all have that intention to do that from the medical standpoint to get rid of the problem. Why is it not impossible? Because instead of this beautiful circular mass that we had, which was filled with sebum, now we have, it's almost like a sac which was perforated, and from different holes of the sac, the sebum comes out, pus comes out. So there's basically this goo, and it doesn't have any structure. So what would you remove? You can't really remove that. And if somebody will try to remove this undefined structure, they will fail. How will they know they will fail? Because it will definitely come back. That is the sign of a failure. So that's why it is not really feasible to remove a cyst at the time or infection or right after, especially right after, because now it's drained, so you barely see anything left, or there may be some pieces of the sac left. And even if you think you're removing those pieces, there are always more left. And anything that's left behind in that subcutaneous tissue will fester again and make another cyst, or rather a cyst recurrence. That is why it is not feasible or possible to remove a cyst at the time of drainage or right after. Usually my recommendation for patients who want to have a definitive removal, definitive excision, is to wait a few months. First, the area has to heal from an infection. Once that is done, then I need to make sure that the cyst is palpable enough for me to remove it. So it cannot be non-palpable, otherwise what are we removing? And are there any situations where the cyst doesn't come back after the drainage? Of course, there are situations like that, and you may be one of these people who had that drainage, or anecdotally somebody, oh, I've had the drainage and my cyst never came back. Yes, that does happen. It happens in rare cases. I would estimate that it probably happens at most under 10% of the time, but that's great. If that happened, that's wonderful, then you don't need to have it removed. Otherwise, an elective excision is usually recommended when cyst is palpable, but before it gets infected. And preferably that it's small and palpable, because the smaller the cyst, the smaller the scar, the less inconvenience it is for the patient to have it removed. So that is why the cyst, when it's infected, can't be removed. It could be drained, it could be treated with antibiotics, but unfortunately, it can't be definitively removed until later. Thank you so much for watching. Until next time. Bye-bye.